Welcome to the Weekly Diabetes, Stuff You Should Know. I'm Marissa Town, Clinical Director for Children with Diabetes. This week, we're going to talk about the antibody response to SARS-CoV-2, also known as COVID-19, in adults with and without diabetes. Let's jump in. Data was collected from 582 patients in a hospital in Italy from February 25th of 2020 to April 19th. It has already been shown in studies from Europe and the UK that diabetes and high blood sugars or hyperglycemia are associated with more severe outcomes of COVID-19, especially pneumonia, and as well an increased risk of mortality. So this study looked at whether or not people with diabetes and high blood glucose levels during the course of their infection would cause antibody changes compared to people without diabetes. They measured the patient's antibodies from blood samples that were stored in the biobank from their hospital stay. 79 of 582 patients were in the ICU or intensive care unit, and 93 of them died during the follow-up of this study. 90 of the patients had diabetes before they came into the hospital, and 49 were diagnosed during their hospital admission. Of those people with diabetes, 13.7% were on insulin. Many of the others were on oral medications. People with diabetes had higher rates of inflammation, tissue damage, higher white blood cell count, and worse kidney and lung function than those without diabetes. But it's not all bad news, thank goodness. The great news is that this study showed that people with diabetes had the same antibody responses compared to those without diabetes when the researchers looked at the data. And the data showed specifically that the RBD IgG antibodies were associated with increased survival rates regardless of gender, presence of diabetes, and length of symptoms. The authors go on to say that high blood sugars were linked to poor outcomes regardless of whether or not the person had diabetes. So a lot of people without diabetes also had high blood glucose levels during their infection. There does need to be more research and further evidence that the antibodies are protective against reinfection of SARS-CoV-2. And science isn't always that simple. To really truly prove that things are effective, you have to be able to replicate the data. And things are still rapidly changing with SARS-CoV-2. So much that they've changed the names. Started out as coronavirus, then COVID-19, and now SARS-CoV-2. The best that we can do as people with diabetes is to try to keep our blood sugars in range, keep our hands clean, practice social distancing, and keep an eye on their latest research findings. Knowledge really is power, and one of the founders of diabetes care from the early 1900s, Dr. Elliot Jocelyn, said, "The diabetic who knows the most lives the longest." Thank you for your time. I hope we've helped you understand a little bit more about the antibody response, and if you'd like more information, we will post the link on the website. And I'd also like to remind you about our upcoming free virtual Winter Friends for Life, or Winter FFL. You can learn more information about it on cwd.is/winterffl. It is from December 4th through 6th, and we hope to see you there. Stay healthy, take care, and see you next week.